welcome any guests that are joining us this evening. And I guess we'll call this meeting to order. And the first item is open forum. And I think Michelle,
Can everybody see the screen? Do you see the agenda?
No.
no.
I don't see the agenda. I just see all of you guys in little tiles.
All right. I just want to get that up. I don't know why it's not open.
It's the Brady Bunch. Michelle, do you want to go ahead and share your thoughts with us?
Sure, happy to. So for anyone who is listening, I would just like to continue to ask people to really continue to take the COVID protocol seriously. Follow your masking rules, follow your social distancing rules, follow your do not mix household rules. I personally had a very serious case of COVID for most of the month of January. My husband, on the other hand, had an extremely mild case of COVID. So there's really no explaining how you personally are going to react to this. I have been very careful. I've been following all the rules. I did not entertain my family for Thanksgiving or Christmas. I have not had anyone in the house, and yet somehow I ended up with COVID. I got extremely sick. I was able to work with the health department staff to contact trace, and Sue Hanley was assigned to my case and was extremely vigilant about following me every day. So thank you, Sue. Once I was cleared to return to work, I experienced what people are now calling COVID bullying. Even though I met all of the requirements of CDC to return to work, people were afraid of me returning to work. So we want to make sure that people are educated. Sue was able to provide me with a letter explaining the CDC return to work guidelines and that I was fully compliant with those. But again, I think it's really important not to become complacent at this point. We're not there yet. If you are eligible for the vaccine, please get it. And, please continue to follow the rules. We're all in this together.
Thanks, Michelle, and we're glad you're feeling better.
Thank you.
I guess we can bring up that as a board, we have written a letter to thank our health department staff for their service. I spoke with everybody individually and everyone felt comfortable with the letter that was drafted. And so I sent it today to our select board and town manager, because our health department has done a remarkable job at keeping up with the many regular responsibilities that are challenging in an average year, and adding that, or adding all the COVID issues on top of that has really been a big ask, and you guys have done a great job. So thank you, Jeff and Ray and Gail and Lori and everyone for all the hard work, and Arnie for all the hard work you're putting in.
Oh, thank you.
Get everybody.
Well, we got Abby too, and Abby's holding up our entire Title V piece. And
Yes.
we have a lot of angry contractors if it wasn't for her that's keeping up with all of the new development in town. So she's doing a fantastic job too. I can only tell you,
Go Abby.
you can't ask for a more dedicated staff. There isn't one thing they won't do. They will stay late, they'll come in early, they'll work weekends. It doesn't matter to them. They will fight for every last little thing that we can. And at the same time, they're amazingly compassionate to every resident and just bending over backwards for whatever they need. So I owe them.
Thank you. All right, I guess we can move on to the next agenda item, which is the approval of minutes. And I didn't have anything. Anybody else have any comments?
No.
Trying
Nothing.
to pull
No.
those up.
They were great. All right, so If there are no comments on them, is there a motion to accept the minutes of January 11th?
I'll make the motion.
Okay, motion made and second.
I'll second that.
Thanks, Michelle. Zach made the motion, Michelle seconded, and seeing no further discussion, all in favor? Say
Aye.
Aye.
Thank you. Motion passes unanimously. So those minutes are accepted. And so the next item on the agenda, let Jeff get that back up. Sorry, we're going too fast for you, Jeff.
It's just, it's going slow. Let me pull that back up.
The next item was the update on the COVID-19 vaccination timeline.
Yes, so this is obviously a topic that a lot of people are extraordinarily interested in. The state obviously is doing this in phases, phase 1, 2, and 3, and within each phase, there are sub-phases within that. So right now we are in phase 2, step 1, which is people over the age of 75. The challenge that we're having is that currently, even though Westford is completely prepped, prepared, and ready to go to run vaccine clinics, and we can scale from anywhere from 1 to 500 a day. Right now, we just don't have any vaccine, and there isn't any to get in the state. There's an extreme shortage. We're learning that the state's looking to push most of the vaccine towards their mass vaccination clinics, and that's where the effort seems to be. This obviously has been frustrating for my department because we were really hoping that we could get to our residents and work with them and keep them home and closer to home. But that is not the way it appears to be shaking out. So what we're doing is we're continuing to monitor and ask for vaccine every single week. Currently, we've asked twice. We've been denied twice. We have not been denied a third time yet, but Saturday and Friday haven't come yet to find out if we're going to get any at all. I'm not anticipating any, but if we do get any, we will stand up a clinic for whatever vaccine we do get.
Jeff, in the event that
yes.
we do get vaccine, how are we going to store it cold storage wise?
Well, we're assuming we're getting Moderna vaccine, and we do have a freezer in the building, and we're fully capable of storing probably 1,500 doses if we ever got that many.
Okay.
So we can
Thank
handle
you.
that. If on the off chance we ever got Pfizer vaccine, believe it or not, there actually is a deep freeze unit in town that I do have access to, and I've already lined up the potential use for if I actually ever did need it. I don't, however, expect to see Pfizer vaccine come to a town.
Can I ask a question? Jeff, how does the request process work? So, I mean, you've been denied twice, but is it, the loudest town gets it, or how does it work?
So there's a survey that every town gets on Monday, and you have until Tuesday to fill that out with the amount of vaccines you get. On Friday, you find out what your allotment's actually going to be. Once you find that out, it gets delivered to you between Monday and Wednesday, Joanne, I believe, correct? I haven't seen it yet, so I can't say I know for sure.
Usually comes on a Tuesday, because that's when it snows. Just saying. Snows every Tuesday, that's when we get vaccine.
So that's the process, and when it shows up, either UPS or FedEx, we'll store it, and once we have it in hand, we will take our clinic that we'll have set up ahead of time and make it go live for the population that we're working with.
And Zach,
what-
Jeff sent a letter to ask why we haven't been getting any, and they really had no answer, although they did indicate that towns with higher incidence were getting perhaps some.
So
more.
what I've done so far, and of course, there's very little that I can do at the state level, but I have sent emails to the highest person I can in DPH and in the Office of Preparedness and Emergency Management in order to find out why we're not getting it when we were told that we had an opportunity to get it. And we did receive some response back that there's a shortage. It's going to the larger sites right now, and if the opportunity arises, we will get it. I have talked to the town manager, who is very interested in seeing local residents vaccinated locally, and she has sent letters to the governor and to Karen Polito and to DPH and to state reps and senators as to what's broken in the system. So I do appreciate her rattling cages as much as she can. However, I think we're going to be at the mercy of what's actually available in the state at this point.
And so go ahead, Jeff.
What I would recommend any resident do that sees this or hears this is go on to mass.gov and go on to the map, look at the sites that are available, and look to register your senior population people. If you need to give a friend or a family member help to do so, please do. The websites are fairly easy to navigate as long as you can get into an appointment. And the state has announced that if you can be a caregiver, you may be able to get a vaccine yourself, but you need to go to one of the state mass vaccination sites to do so.
So I spent today working for my mother and was able to get myself and she as caregiver and myself me as a caregiver appointment in the Danvers site. The Gillette and Fenway sites have a lot of vaccines starting next week. So there are new appointments there. And then the hospital in Worcester was the only other one that I could see that from our area was available to Westford or open residents in a reasonable distance. And they had a few appointments for over 70.
So one thing is it's not caregivers, it's companions. So you don't have to necessarily be doing any direct care. It's just to accompany a senior through a mass, and it's a mass vaccination site, not the local sites.
And so and Gillette sites were not for that, but Danvers was.
Yeah. So, I mean, just for clarity, so, you know, if somebody just needed a ride to say, go to the site, but they otherwise can maneuver, that's fine. Doesn't have to be a caregiver as a companion.
Right. Thanks.
Yep.
And so does the companion need to have an appointment too, or just be present when the eligible person has an appointment?
The
The
companion
companion has to have an appointment on the same day, and it's not retroactive to anything that happened prior to this. And you have to have an appointment. Getting an appointment at the exact same time would be a miracle, but it has to be the same day as the person that you're with. So, there are some caveats, but, just my other hat, please read the instructions. This is for the mass sites, the big mass vaccination sites only. And if you're looking on the website for something local, make sure you read the instructions, because a lot of the local sites are restricted to that municipality.
Right. The one I could see really that worked for us outside of the mass vaccination sites was one of the ones in Worcester.
Yeah.
Or other are far, far away.
Lowell General should be coming, online fairly soon, so be on the lookout for that. They did their soft rollout this week, so
And Joanne, who's going to have access to that site?
Lowell, the
Yeah.
hospital site, the region.
The whole region?
But I mean, for the that's my understanding. I'm not speaking for the hospital, but it's set up as a regional site. It's not. It could be like a lot of these semi-large regional sites may morph into a mass vaccination site. Who knows? Going down the road, but it was set up initially as a regional site. So just be on the lookout, because eventually they'll be announcing how to log on and get appointments. But again, it's phase 1 and 75 and over. Step 1 in phase 2 only.
And maybe Jeff or Joanne could explain this, because I've gotten a lot of questions about it, because I know the federal government basically put the vaccine into kind of 3 sections, right? Local boards of health, pharmacies and what's the third one?
Mass vac sites.
Yeah, I guess mass vac sites. People are kind of confused. They're asking me what the difference between them is. You know, are they supposed to do one over the other? Does it matter? Do you have any advice on that?
It doesn't matter unless the site you're going to at a local site is limited to the residents of that site or a particular population within that site. So what Joanne said earlier, you've got to read the instructions on the website that you're going to. But
Right.
the mass vaccination sites, anybody can go. So if you go to Gillette, or you go to Danvers, you go to Fenway Park, those are open to anybody at any time.
Within the phase. Within the eligible phase. Right. So the federal government actually allowed the states to decide on their own what they would do with their allocation. So that's why you're going to see that New Hampshire's already started with their 65s, and some started with their elderly, not their healthcare people. So the states were allowed to decide. And, you know, part of how the allocation comes down from the federal government is how we who are vaccinating report back to the state reports up to the federal government. So the state's allotment is based on the vaccination rates within this state. They have like a similar reporting system that we do. So that's how they're, you know, the individual states, or at least in Massachusetts, how they get their allocation. And so we're all kind of going through the same process of whoever's holding the vaccine, you know, as it comes down the pipeline. So the state's kind of on the hook, just like we're on the hook. But, you know, Westford isn't alone. It isn't like, you know, we're out there by ourselves. There's a lot of communities that are not getting vaccine.
I think it's important to note too, I mean, I feel like we've been spreading a little bit of doom and gloom that we're not getting the vaccine and there's none locally. But the fact of the matter is a lot of people are getting vaccinated every day. And it's not as fast as we would like. It's not the way we would like it locally, that's for sure. But people are getting vaccinated every day. And if people just do a little bit of work and go to places like Lawrence, and they go to Danvers, and if you want to drive to Gillette, do that. You're going to get an appointment. You may not get one the day you want, but you will get one.
Yeah.
So,
And more sites are opening. I just noticed today on the site that there's, I think it was a Hannaford's and Dracut. I mean, so they're opening it up now to the CVS's and the Walgreens, and then the bigger chains, you know, the Hannaford's and the Big Y's and the Price Choppers and things like that. So, you know, they're rolling it out more and more. There will be more sites coming. And obviously in this area, if your personal physician is a member of Circle Health or part of the hospital, you call your personal physician. That would be the only time you would. Otherwise, personal physicians don't have vaccine in their offices yet. But if they're part of that group, that would also get you into the, you know, the hospital system too.
Thank you, Joanne and Jeff. I think we are now ready to move on to our next agenda item, which is the variance request from the bylaw for the polystyrene restriction by the Westford schools.
all right, let me pull that up.
And I know we have some people joining us to discuss this.
All right, do you guys see that variance?
Yes, Colleen. I was squinting at my screen, but
All right, so I am going to, this is Colleen Wallace's request. I believe she was online. I do not see her.
was on.
Yeah, I'm just going through the list and I don't see Colleen as one of our participants, and I did talk to her earlier. And hopefully, Colleen, if you're able to watch somehow, you can either text me or call in on me if you have anything you want to add. So what I will just do is Obviously, you've read the variance, and they are looking for a variance from the polystyrene bylaw at this time. And I will also, when I talk to her, actually, she tried calling in right now. And I have Colleen on my speaker on my phone right now, so I don't know if she'll be able to hear, but
Sorry, Jeff, I had called in, but I apparently couldn't hear me, so I just called your cell phone.
okay. Can everybody hear Colleen?
A little bit.
Yeah.
All right, Colleen, why don't you give the board an explanation of what you're looking to do? I've got you on the speaker.
Okay, great. At the beginning of July, I had requested a variance to the polystyrene ban in Westford to assist the Westford Public Schools food service program with our packaging needs as we moved forward into this new model of lunch service, which is that we pack remote meal kits for families, a weekly meal kit, which is 10 meals per child. And in addition to that, for the in-person learners, they take a lunch to go every day. So in anticipation of the strain on the supply chain, I had requested a variance so that we could use alternative products if and when necessary. Most of these products, it's very limited in what we actually need to do outside of the polystyrene ban. The product that we use most is a single-use plastic bag. They call it a t-shirt bag. It's similar to what you would have gotten at Market Basket prior to the polystyrene ban, a plastic bag with two handles, so to speak, that you can tie together, not so that a lunch can be transported safely. There's no spillage, there's no leakage. The other product that we do use is either an 8 or 12 ounce styrofoam cup, and we use that to package salads to go, or we make meals to go, basically casseroles, American chop suey, chicken broccoli ziti, that type of thing, that we can package safely. And by safely, I mean that securely, the lid is secure, the food doesn't leak, it can't cross-contaminate other products that are in these lunch bags. And that's basically what I'm looking for, is a variance so that if and when I might need to use these alternate products, I definitely have to use the plastic bags. I just wanted the Board of Health's approval to use these products.
Can I ask something?
Yes, Sue?
Are they products that you currently have in stock that you're trying to use up, or are you purchasing new products?
Well, we have to purchase new products based on the demand. We didn't have these products in stock because the polystyrene ban had been in effect for 2 years. So we started using these products at the start of the school year, and I'd like to continue using them.
Just for this year with the COVID changes, is that correct?
That's correct. Mm-hmm.
But why? Why do we need to use these products and not stick?
I think my understanding,
So the alternative to this if I didn't use a single service plastic bag, if I didn't put a 4 or 5-year-old's lunch or an 18-year-old's lunch in a plastic bag, they're taking this bag from school. They can't eat it on site. They have to bring it home. We're going to put all of the meal components into a paper bag, say. That bag can leak, the products leak, milk cartons are wet, milk cartons spill. The molded fiber products definitely leak. They do not hold up for very long. So we're using these products because nothing is being eaten on site. Everything is takeout and take home.
Are there other questions? Do we have questions from our,
Looks like we have a hand raised.
okay.
Let me see. It's Susan Thomas. I'm going to unmute her. And Susan, I think you are self-muted at this point.
Susan, will you, I guess, should she be saying her address? Just addressing us?
Yeah, Susan, you can actually ask your question. You should be unmuted.
Hi, can you hear me?
Yes.
Yes.
Okay,
Yeah.
I'm Susan Thomas. I live at 7 Old Homestead in Westford. I have sort of a series of questions. First of all, there are two bans, a plastic bag ban and a polystyrene ban, as I understand it. So
Yes.
what I'm hearing is the schools have a waiver for polystyrene, but they're also violating the plastic bag ban. The second thing I'd like to point out is that polystyrene leaches into hot foods. So while leakage may be a problem in other materials, there is a health concern with putting hot foods in polystyrene.
Correct, but we are not packaging hot foods. We are packaging cold foods to be taken home to be reheated, and we are including instructions with these foods that they are not to be heated in that container.
Thank
Okay.
you, Colleen. Jeff, do
Um,
we know if the bag that they're using is actually a bag that falls under the plastic bag ban, which has kind of been waived through COVID so far?
You know, I'm extremely limited in the products that I'm able to purchase. You know, school food service, we are limited in the vendors that are available to us. So I don't have the luxury of sourcing products from multiple vendors. I have what is available through the vendors with whom we are contracted. And our products,
I understand
you know,
that,
these products
Colleen,
are
but
very limited.
the polystyrene ban exists in several towns in Massachusetts, all of whose schools are limited to the same set of vendors that you are.
You're right.
So I'm wondering if you're sharing best practices with other school districts to find out how this is working for them.
I have not reached out to other school districts to see what they're doing. You know, it really wasn't an issue, and it's really not an issue. I mean, I asked for the variance, but if the consensus is that that's not something you want to see done, then everything can be packaged in paper. It's, you know, but I'm just putting it out there that, you know, there may be spillage, there may be leakage. It may be cumbersome for a small child to carry that paper bag home as opposed to a plastic bag that might fit in his or her backpack. I mean,
Well,
if
it's
really
not hot, I don't see the safety concern that you're talking about. If it's hot food,
Madam Chair, they shouldn't be talking back and forth to each other.
Sorry,
I'm so
Susan, you need to address us, and we have limited time, so can we quickly address the issues here? Susan, what was your question?
I guess I'm just, I'd like a clearer understanding of the safety issue. And,
Okay,
I'm just concerned about the slippery slope that if the schools do this, I can imagine a restaurant coming and saying that it's a huge hurdle for them financially as well.
I didn't say financial hurdle at all. I really didn't. What I'm saying is I'm thinking of a child transporting his or her meal in paper. I'm not saying that it's not doable. I'm just saying that from a safety standpoint, the food is less likely to spill and cause, you know, a danger with someone falling or slipping or whatever the case may be. And also the products, the styrofoam products seal much better than the molded fiber products, which means that there's less chance of cross-contamination between food products because they're sealed a little bit better. I mean, as I said, none of this is insurmountable. It's just something that I put out there as a request to make, to give us options in the event that we cannot source the products that are in compliance with the polystyrene ban. That's all I'm looking for, is the flexibility to say, okay, well, I'm sorry, I tried to get it, but I couldn't. And this is what I had to do because I have to feed these children every day. I can't say, sorry, there's no lunch tomorrow because we don't have the proper packaging.
Thank you, Colleen. Sue, you had a question?
Yeah, so we're in February now. So what have you been using since the beginning of the year?
We had a waiver.
We had the
granted.
variance. We had the variance.
We actually granted this through December
July.
31st.
So you're looking to expand it. I got it. Okay.
Send it.
That's correct.
And I believe, Colleen, the first variance, you had leftover product as well that you needed to use up.
That is correct. Yes.
Zach, you have a question or a comment?
Yeah, a question about the, so you're using polystyrene now. Could you switch to like HDPE, high density polyethylene, which would be recyclable?
Perhaps. As I said, I'm very limited by what my vendors now have available because, you know, this pandemic is nationwide. It's affecting every school district in the country. Supply and demand is, it's tricky. You know, there are a lot of products that we can't get when we need them. So if those products are available, yes, of course, as I said in my request, I'm doing my best to be totally compliant, but there are extenuating circumstances for which I would like flexibility.
Thank you. Are there any other comments or questions from the board? I guess the one question I have is whether, you know, if we had granted previously, do they need a separate waiver from the plastic bag ban? That was just going into place now, right?
The plastic bag waiver was pushed out till the 31st of December as well, and that actually has expired as well. And I will tell you that we have them out of the grocery stores again for that small period of time that they were in. We got them back out again, so they're back to paper and reusable bags in the grocery stores.
And are we sure if the type of bags that the schools are using is in that same category as the banned bags or not? I haven't seen them.
I haven't seen those bags yet myself on what they're using. If they're single-use thin film plastic bags, those would fall under the plastic bag ban.
They are. That's what they are.
All right, Zach?
I would just say, you know, my thoughts are that since it didn't sound like there's a financial or a health reason not to go to paper, my feeling is that we should be going, you know, back to the rules that we had before, which are, you know, paper when possible, and non-plastic bags and non-polystyrene.
I would say that one of my concerns, however, would be that students transporting computers back and forth, if we're concerned about things spilling, that is a concern when they're carrying lunches, which they don't normally do. Joanne?
My concern is them spilling, dropping, and then not eating. So, I mean, that we have some unique issues happening right now that maybe we need some flexibility. I think my own would be, you know, do all as best you can, source out, you know, with whatever vendors you have, the best products you can, but to give the flexibility in order to be able to make sure that these kids can get their food home safely in one piece and not spilled all over the place, or, you know, whatever else that could happen. Obviously try to get those products that we would rather see, but we got to make sure the kids are fed.
Thank you. Michelle?
I would agree with Joanne. I think the priority here is getting kids to get their food home safely and edible and not spilled all over their backpacks. And I think this is a temporary situation, and we are in a pandemic, which is not going away anytime soon. And I would agree. Colleen's doing her best to follow the rules, and when flexibility is necessary, I think it should be allowed.
Okay, we have a comment that I'll read from Valerie Young, which says that the exterior thin film bag has been helpful to contain the interior paper bag for my second grader to carry it home on the bus. Thank you, Valerie. Yeah, I think maybe, Colleen, what you've heard is that there's if at all possible, to find out what other towns are doing to try and minimize this and find the best products. That is certainly the preference of the town and the board. Joanne?
I would also ask that as a condition, maybe it is when you can't find products and you have to go to something that obviously isn't, what would be everybody's choice, that you do contact Jeff or the health, or someone from the health department, Ray, whoever, and let them know, what it is that you need to buy and why, and, just make sure that we are kept, or the health department is kept in the loop when some of these products have to be used that wouldn't normally be okay.
Of course.
There was a second comment from Valerie Young asking that perhaps we can push some education on how the exterior bags can be brought back to Market Basket for recycling or something. And Zach, you had a question, and then.
Yeah, just a comment. Could we suggest that kids bring reusable bags, and that those kids that do, could they get paper products instead?
My understanding is this is all prepackaged in advance for pickup.
That's correct. And
Right. So I'm just saying, if you knew that, say, 50% of the kids would have, be bringing in reusable bags, that you'd make 50% of the lunches in paper products.
But the problem with that, Zach, is that this all has to be done well in advance of the students are not coming into the cafeterias. This is all distributed at the dismissal points or delivered to the classrooms. The other problem with that I would see is taking materials that have come from the household. We don't know what's in those bags, what has been in those bags, and I would not be comfortable sending out our food in containers that we are not,
No, I guess you're misunderstanding. I'm saying, if you know that, say, 50% of the kids are bringing in reusable bags, then you can pre-package 50% of the lunches in, say, paper. That you're not touching any of the reusable bags. Those are the kids, so they can put that lunch into their reusable bag in case it spills.
But it isn't the bag. Well, there's two issues. One is the plastic bag, and the other is the products that the food are going into. Those are the things that leak and spill. So that wouldn't help that piece. It would only help the plastic bag piece, the carrying home piece.
Right. My argument is that there's plenty of high density polyethylene and PET products that replace polystyrene. This is why we did this ban. Those are out there. Those suppliers have those. And it hasn't been a problem for other school districts, so they're not going to leak. I mean, I
don't know that we know that this hasn't been a problem for other school districts. I'm pretty sure that quite a few school districts have passed variances on this. I had heard of that earlier in the year. I don't know if anybody has actually done research on that, but I had heard of other variances, I believe.
So we have another question from Barry Rosenberg. Barry, I have your mic on.
Okay, Jeff.
Yes, I know you do. Thank you.
I'm sorry.
Have you considered, is one of the vendors that are available to schools world-centric? I know that was broached to the superintendent 8 years ago by my son.
Colleen, is that
Who is this person?
Oh, Barry, can you
No, that's not one of the vendors that's available.
Barry Rosenberg,
to us.
10 Groton Road.
Thank you.
And Colleen, you said they are not one of the vendors?
No, they are not.
Okay.
They're not. The vendors with whom I'm contracted, these contracts were put into place well before the pandemic hit. So I'm very limited in the products that are available to me. None of this was anticipated last year when we were putting together these bids.
Right,
and
thank you.
Contracts were awarded.
Okay, thank you, Colleen. Sorry, Jeff, and the board, we're over time for this issue, and we do have somebody waiting to talk with us on our other item, on our tobacco regulations. So are we ready to make a motion? It seems like perhaps they need two variances, one on the plastic bag and one on the polystyrene at this point.
So, so you need you want two separate motions, Steph?
I think we need two because it's two different.
Just a point of order, because on the agenda you only have a variance request for the polystyrene restriction, I don't know that we can grant a variance tonight for the other bylaw.
The bags.
So that one,
Yeah.
Colleen, we might need to come back on.
Yeah,
I'm sorry you broke up there.
The bag, if the plastic bags now are now a thing, I think that has to come back for our next meeting for the variance. Is that because it wasn't on the agenda?
yeah, only the polystyrene was on the agenda.
Okay. So do we have anybody who's willing to make the motion on this?
I'll make a motion. I'll make a motion to grant the variance request as written with the addition of a requirement to research all of the available products and choose a product that would not require the variance first, and only choose a polystyrene product when there's no other option.
Okay, I have most of that.
I was making it, trying to word it as I went. I think it through.
Okay. So hopefully, Jeff, how do we, or Zach, if I don't have that word for word, do we take it off the thing or do I?
We can take it directly off the recording and I'll have our minute taker make sure that's written the way Joanne has said it.
I tried to word it such that the polystyrene would be the
Product of
last choice, the choice of last resort.
Point of order.
Yeah.
I'm in favor of Joanne's motion. I just wonder how you intend to enforce that.
How would I enforce it, Zach?
Yeah.
Can we have a second and then we can discuss that?
I'll
Sure.
second that.
I'll second.
Okay,
Yeah.
2 seconds. Jeff, the question is, how would we enforce this?
So honestly, we're stretched fairly thin. So I'm not going to have a staff member at Colleen's office when she's ordering. We can certainly discuss what's available. And as professionals, I think I would need to trust Colleen that she's doing the right thing. And if there's question, I'll be more than happy to talk with her.
There are also 2 more comments that I guess we have to read in because of the things, which was that, is it possible to limit inventory to what is needed through the timeframe of the variance? We'd hate to see the schools get stuck with a bunch of product they cannot use, from Susan Thomas. Colleen, is that something you are working hard to limit? Maybe we need to, do we need to amend the variance to say?
Well,
we're just,
I think what, I'm trying to get across to everyone is that I'm only using these products when absolutely necessary. In, 99% of the situations, we are using compliant products. You know, as far as using up what we have in inventory, I mean, it's different in every school. You know, Westford Academy might have 3 cases of plastic bags. The Robinson Elementary School might have 1 case. So, you know, obviously we've already purchased these products. They're sitting in our storerooms. We do have to, it would be, you know, optima if we could utilize all of these products. But if there's a ban and we can't use them, then we can't use them in the food service program. We'll have to absorb the loss.
Okay, thank you. So is there any other discussion? All right, we'll take a vote then on all in favor of the motion to accept the variance with the wording that Joanne has amended it with. Say aye.
Aye.
Hi.
Motion passes unanimously then. All right, thank you everyone for your concern. We clearly are all concerned that we do our best to use products that are good for the environment and good for ourselves as well. And I think that that is
Thank
the
you.
spirit of this.
Thank you, Colleen.
Thank you.
Thanks, Jeff.
Bye.
Okay, so we will now move to our next agenda item, which is the final reading of the Westford smoke-free workplace regulation. Smoking fleas.
COVID fleas.
All right, Sarah, I have just made you a panelist.
I saw that.
Hi, Sarah.
Do you hear me?
You.
Hi, can you hear me okay?
Yes.
Yes,
Yes.
thanks for joining us again.
No problem.
All right, so I will pull this up.
So were there any comments from legal, Jeff?
All right, so there were some comments from legal. KP Law did go through this entire document. Greg Corbo had changed a couple of definitions that he felt more comfortable with. Both read, I think, fairly similar to what Sarah and DJ had put together, but I think attorneys have their own particular wording they like better. And Sarah, would you agree that they were reasonable in their interpretation for the most part?
Definitely. I sent KP Law's comments back to DJ Wilson from Mass Municipal, and he had absolutely no issue with any of the comments at all. And in fact, there's some conversation about, since KP Law represents so many municipalities, that we may change our sample regulation to pick up a lot of his comments. It would just make sense. So yeah, no issues at all on our end.
So what I would like to do at this point is to let everybody know that's listening in TV land that we will have copies of the regulation at our front desk, and I am more than happy to send anybody electronically copies of the draft of the regulation. And I will, as soon as I can, set a public hearing for our March meeting, which I will post in the newspaper 7 and 14 days ahead of time. I believe those are the 2 dates I need to use. It will be in the Westford Eagle, and we can then have a public hearing and vote to adopt the updated Westford smoke-free regulations that we have. And the interesting piece is we actually are adopting one new one and an updated regulation. So one is the smoke-free workplace regulation, and the other one is our new Westford smoking regulation, which is adopting all of the state regulations that have been accepted in many parts of the state and puts us more in line with where the state is. Did I miss anything?
Jeff, I'm just wondering, I can't see it, it's so minuscule on my screen, but the smoke-free workplace regulation, did I send you a draft on that, or did I just send you our sample?
You sent me a draft and we worked on it, and I sent that off to KP Law as well.
Okay, all righty.
Got both of them. I don't know if I can get any bigger.
Raise your hand.
Yeah, a quick question. Since I assume most people probably don't want to come down to the town hall to pick up a copy, and although it's great that you'll send them an email, would it be appropriate to put it on the Board of Health website as a draft, and that way people could just retrieve it without having to bug staff, who I'm sure are
Yeah.
super busy right now?
Yeah, I would most likely do that anyway. That's, for a lot of things, that's almost automatic. So yeah, it would definitely be there.
Great. Any other questions or comments about that then? Okay, thank you. So now we are at new business and and thank you, Sarah, for joining us once again.
You're welcome. Good night, everybody.
And I
Good
just
night.
want to say, Sarah, before you go, Sarah, MHOA, Mass Health Officers Association, has been absolutely fantastic to work with. She's done a lot of work for us that we would have probably struggled with in-house. So she's an invaluable resource through MHOA. We're glad that she was available for us. So I would
Thank you so
recommend
much.
any other community to use her if she has, if they need to.
Anytime. Good night, everybody.
Good night.
Thank you,
Sarah.
Sarah.
Thank you.
Good
Good
night.
night.
Thank you.
Okay, so new business, the FY22 budget, Jeff.
All right, I'm just pulling the agenda back up. And I didn't realize it was so small for people to see.
You didn't see me like looking like this.
Because on my screen, I see a full screen. I didn't realize people were seeing something smaller. So town manager has made her recommendations for FY22. As far as our operating budget, she has made some cuts, and according to the town manager, she's made similar cuts in all budgets. Our overall cut in our operating budget is around $1,800, which is overall, I'm disappointed we're losing it in meetings and travel, because we use a lot of that meeting time for CEUs that our well-credentialed staff needs, but I think I'll be able to make some of that up this year. And I did discuss hoping to restore that for FY23. Another portion of our budget that I know we had discussed in the past is making Gail, our public health nurse, a full-time person at 37.5 hours, because currently that position's been budgeted at 30 hours. I had a very good conversation with the town manager about that. She's actually very much behind making sure we have the resources we need at the time, but there are some serious shortfalls in the budget. Many positions aren't getting filled. I don't know who might have seen the town manager's report on Tuesday night in the selectmen's meeting, or the select board's meeting now. But there are firefighters positions not being filled. There are police officer positions not being filled. There's assessor positions not being filled. And she can at this time honor the 7.5 hour increase I'm looking for. That said, she is certainly aware that we're working extremely hard. And she knows that we need that position filled at some point, but we also have a fairly good amount of free cash that we can do that with, and that's in CARES Act funding and some state money we got from the MAPC. And Jody has committed to being able to fill that shortfall of the 7.5 hours through CARES Act funding at this point. And she brought that up within her select board meeting, which was very good to hear. And we do have some extra funding that's come in the amount of $12,000 that can fill that gap as well. So I think even though she can't fill it in the normal operating budget, we do have funding that will allow staff to be paid and get their overtime for the time they're working. I'm satisfied with that for the time being. Go ahead, Sue.
I just, my only concern will always be that we've already had the substance, we've had that position taken away. So it's easy to say we've got the CARE Act money, and that's great. But for somebody like Gail, that doesn't help her with her next step of life when we think about pensions and looking forward. That's not you know, that's just filling the gap right now. So I just want to make sure that we don't keep pushing this off and saying it's just not in the budget. I just worry the health department. It just, you know, we've had cuts before. And I'm just afraid we're not going to get it back. So.
Zach?
I agree with Sue, and you know, to your point about Gail, it is great that we have some federal and state money right now, but we don't know what that will be in the future, and we also don't know who's going to be in this position in the future when we as a board have to go look for a new person some years down the road. We want to make sure that we have a fully funded full-time position, and we're not stuck in the same situation we're in now. So I feel like I completely understand the position the town's in right now, but we've been asking for this for a long time. It's not like this just came up because of COVID, and so I feel like we're not even that far from our goal here. I mean, it's, you know, it's relatively small number of hours, so I feel like it really is important that we push as a board to get this position filled, because what are we going to do? You know, this isn't something that's going away. I mean, this isn't, you know, it's going to be over and then we're going to have wonderful days again. This is always going to be some part of our lives.
Well, I can tell you that in March, they will start the budget hearings with FinCom and the select board. I will certainly make sure that the board knows when that is, and I am more than happy to have all of you there. So when we get to that point, that is great. But I just want to.
Michelle?
Is this a topic that we want to put on town warrant and have the town vote on whether or not we need a full-time public health nurse? Because obviously we do. I think we have plenty of, you know, pandemic-related information that would warrant that this position needs to be full-time.
Good idea.
Yeah, how does that happen?
We've done it before.
Somebody needs to file a petition for town meeting.
No, we can put a
Does that
budget,
come
we can
from-
put a warrant together as the board. You know, put forward a warrant article. That's how
I
we
think
get.
that would be a good idea.
Does anybody want to work?
Exactly that many years ago. Remember?
I also just, I mean, politically speaking, if we were to talk to Jody about that, this is the direction we're going to go in, that could potentially loosen up some funding.
I'd be happy to be involved in working on a warrant. If somebody can steer me in the right how to do it, I'd be happy to work on that.
Anybody else? Zach, do you have the?
I'd be glad to help too. Sure.
Okay, so maybe Sue and Zach, would you like to look into that and figure out what we need to do to make sure that we really, I've done some research on the topic, so I'm happy to supply some research material to it.
So I can tell you that what you'll need to go is go to the clerk's office and fill out a request form to put a warrant on the town meeting agenda, which I don't believe is a complicated process within itself.
Okay. All right,
I
Zach,
don't
we
know
can
when
talk
that-
about it.
I don't know when that warrant actually closes, but I don't think I'd wait too long because the town meeting is going to be, I believe, in June again.
So if
Okay.
we want material to support our reason, we just need to have that ready for town meeting, or is there a time when we need that in addition?
We would want that for town meeting to present then, and probably prior to that as well, but I think what you'd be looking for is the amount of hours that have been put in from, especially through COVID, from probably March of last year through now.
I know what some other towns that are similar to us might be doing, or towards what we'd like to look like. Excuse
Okay.
me.
Bless you.
Thank you. Okay, I think that is the end of our new business. Is there any correspondence, Jeff?
The only correspondence that I can, didn't make it into the packet was emails that were put in late on Saturday night to the state regarding the denial of vaccine, but I can forward those along to you as well.
Terrific. Then I think we're at the end of our meeting tonight. Is there somebody who'd like to make a motion?
Thank you, Stephanie.
Wow. Record time, Steph.
Chop chop so we can all
You
Not bad
get
for a
dinner
third
waiting.
position.
what was that?
You get dinner waiting,
Yeah.
Right.
right?
All right. Does anybody want to make a motion to adjourn?
I'll make a motion.
All right, Joanne and
I'll
Michelle, is
second.
that a second? Thank you.
Yeah.
All in favor? Say
Bye.
Passes unanimously.
Bye.
Hi, everybody.
Good night.
We got to see each other twice this week. How
I know,
nice.
how fun.
Yep. Be safe, everyone.
Take care.
Good night, everybody.
Bye.
And
Where is the end?
I can't get myself off the meeting.
We're stuck with each other, Jeff.
All right, I hide control panel, and there it is. All right, good night, Michelle.
Good night. Take care.